You or someone you care about may have been recently diagnosed with breast cancer. This video will help you understand what breast cancer is and how it affects your body. The breasts are a pair of organs that sit directly under the skin on your chest. On the outside of the breast is the nipple. The darker circle of skin surrounding it is called the areola. In women, breasts are made of fatty tissue, milk-producing glands, and tubes called ducts. A large network of lymph vessels and lymph nodes sits in and around the breast. Fluid from the breast drains through the lymph vessels into the lymph nodes. If the fluid contains harmful substances, such as bacteria or viruses, immune cells inside the lymph nodes attack and destroy them. From there, most of the fluid passes to lymph nodes under your arm, then to other lymph nodes and vessels emptying into your bloodstream. Most breast cancer starts in the ducts of the breast, but it can grow in any part of the breast. Here, cancer cells form from duct cells lining the ducts. They can grow and multiply to form a cancerous tumor. Over time, the cancer cells can spread through the lymph nodes. The following may be signs or symptoms of breast cancer. Note that these signs and symptoms are not all-inclusive. During a routine breast exam, you or your doctor may feel a small, hard lump in your breast or underarm. In addition, you may have some liquid coming out of your nipple, or you may see dimples in the skin of your breast. Your doctor will use certain terms to describe the progression of your cancer, called staging. Staging for breast cancer is complex. The following staging descriptions are meant as a general overview and are not all-inclusive. Stage 0 means abnormal cells are found, but have not spread beyond where they started to other tissues in the breast. Stage 1 means a tumor smaller than 2 centimeters within the breast tissue. Stage 2A means the breast may have cancer in lymph nodes in the armpit, or it can be a tumor 2 centimeters or smaller with cancer in the armpit lymph nodes. Stage 2A can also be a tumor between 2 to 5 centimeters with no spread to the lymph nodes. Stage 2B means the breast may have a tumor between 2 to 5 centimeters with cancer in the armpit lymph nodes. Or it can be a tumor larger than 5 centimeters with no lymph node spread. Stage 3A means the breast may have any size tumor with cancer in the armpit lymph nodes. Or it can be a tumor larger than 5 centimeters with cancer in the armpit lymph nodes. Stage 3B means the tumor may be any size and cancer may have spread to the chest wall, the skin of the breast, and or lymph nodes in the armpit. Stage 3C means the breast may have no visible tumor or any size tumor with spread to the lymph nodes in the armpit, breastbone, or around the collarbone. Stage 4 means the cancer has spread to distant organs. You may be wondering how you got breast cancer. While it's impossible to predict exactly who will get breast cancer, there are some things that can increase your risk. Being female, increased age, taking hormone replacement therapy, having your first child after the age of 30, exposure to chest radiation, and a family history of breast cancer. This list is not all-inclusive. As you deal with a diagnosis of breast cancer, continue to talk to your doctor and your cancer care team.
Want to learn what breast cancer is and what it means? We will teach you all about it. If you've been diagnosed with breast cancer, you're likely to have an invasive breast cancer. which amounts to about 80% of things we call breast cancer. 20% is a precancerous condition called DCIS, which we cover in detail at our DCIS lesson at the Breast Cancer School for Patients. Invasive means the cancer cells in the tumor of your breast potentially have the ability to spread beyond the breast to other parts of the body and threaten you. But be reassured, the threat to you is generally less than you think. In this lesson, I'm going to teach you about the different types of invasive breast cancer. I'm going to review with you what the threat to your life is when you have an invasive breast cancer. I'm also going to go over how it's treated and the timeline for treatment.
Good night, good night, good night, everyone. Welcome to another episode of Bouyon. Guys, tonight we're gonna discuss a very important topic that affects a lot of us. But before we do that, I just have like two announcements to make. I first want to just kind of like talk about COVID a little bit, tell people to practice and to exercise all of the protocols that's in place. The numbers back home they're going down dramatically, and that's a good thing because last episode, when I was on sidewalk talking last 2 weeks ago, our active cases were 1,400, and this weekend it has gone down to about 680 something, I think, just around the below 700. So that means that we are doing progress, we're making progress, we're heading in the right direction. So I want people to keep practicing the protocols, keep ensuring that you wash your hands, you wear your mask, social distancing. These things are important because COVID is no joke. I also want to thank individuals who have, because right now we know how COVID has hit St. Lucia schools. A lot of schools are, remote and so on. So I want to like thank and encourage, or the people who have not contributed, I want to encourage them to do so. We have a tablet drive. We are trying to. The goal is to get 150. I'm really aiming for like 200, to be honest. Tablets. So feel free to donate if you haven't. Please do. Even if it's $20, $5, whatever, donate. Or you can have the link direct and order it and send it to me, and we'll get those shipped. I'm trying to get all of these out by November to people in St. Lucia, or the children in St. Lucia rather, who need them. So I want to say to you, you know, if you don't have $51 to buy a tablet with tax and everything, I think it's $51. Feel free to donate the $20. Feel free to Zelle me 347 392 8282. Feel free to Zelle me, and we will of course get these tablets ordered, because if you give a $20, somebody give 20, that's one tablet pretty much there already. So I want to thank those who have contributed, and I want to encourage those who haven't to please contribute. I really want to thank everyone who has joined us on the live tonight. I want to say thank you guys. Thank you so much for joining us. Tonight, I may not be able to call out names as I normally do because this topic is so important, and I don't want to like take time calling names. Not that you're not important, but I want to deal with the topic at hand, because breast cancer, cancer in the whole, is just a topic that in some areas is taboo. People are afraid of talking about it. So we and Bouyon, we bring it out to your live. October is Breast Cancer Awareness Month. So tonight I'm going to speak about the ladies first. We have Sharon Callender, who is a survivor of breast cancer. She got the 3 positives. So that I'm going to ask her to explain in our discussion, of course, so people understand better what this is. I think it's 5 years now since she was diagnosed with breast cancer, and I want to welcome her on Bouyon. We're going to speak we have with us Dorothy Phillip, who has undergone numerous surgeries with reference to breast cancer because of breast cancer. She is also a member, and I'll let her talk about this a lot more in the discussion, Faces of Cancer St. Lucia, which is a a big movement helping people who are going through cancer, who are dealing rather with cancer. And she will share her story. She's, like I said, she's also a survivor of cancer. And we have the man himself, who is, of course, the educator, the doctor, the individual who will tell us more about what is cancer and the effects that cancer has on the body. So I want to welcome Sharon, Dorothy, and Owen Gabriel for being here with us on Bouyon tonight. I want to say to you guys, thank you, thank you, thank you so much. Please, guys, feel free to put your cameras on. Please feel let's see what you look like. You know, I know when Owen came on earlier on, he had Go Peter behind him. So I don't know if he was thinking of drinking a nice cold Peter beer or what he was thinking of, but I like it. So yes. Good night, guys. How are you all doing tonight?
Good.
You all look good. Nice, nice. Okay.
Thank you for the wonderful introduction.
Okay, before I give each of you the opportunity to introduce yourselves, let's just give a big shout out to the individuals who have joined us tonight, because remember, Bouyon is live and it's an interactive show. So I encourage members of the public to share their views as well as any questions that they may have for my panel. So I want to say good night to everyone who has joined us. Tonight, I may not be able to call your name, guys, but please forgive me for that. But it's just that the topic at hand is so important, and I don't want to spend time, to be honest, calling names. And, you know, I want to get to the bottom of the discussion. So I'm not going to call names, anybody's name, so nobody take any offense to it. But I want to say thank you and thank you so much for joining us on Bouyon tonight. So my esteemed panelists, good night to you guys. And thank you so much once again for being part of Bouyon and the observation of, or the celebration. I say celebration. I don't know if that's the right word to use for Cancer Awareness Month. I want to give each of you the opportunity to introduce yourselves. I will start with the ladies. Owen, take no offense to that. I will start with the ladies. I'll start with Sharon, then we'll go down to then we'll go down to Dorothy, and then of course yourself, Owen. So Sharon, tell us a little bit about yourself.
My name is Sharon Callender. I am a stage-free, triple positive breast cancer survivor. Tomorrow will be 5 years since I got the news that I am breast cancer positive, and life is good for me. So I am good.
Awesome. It's all yours, Dorothy.
Okay, my name is Dorothy K. Phillip. I like to say my whole name because when I say Dorothy Phillip, some people get confused, but it's me, Dorothy K. Phillip. I am a breast cancer survivor. It's 14 years now. And I am the founder and president of Faces of Cancer St. Lucia. I'm also a patient navigator for breast and pancreatic cancer.
Wow. Thank you. Dorothy, I didn't know that about you, but you see, it's a good thing when you ask people to introduce themselves, right? Pancreatic cancer. This is one of the cancers which, and I'm sure Doc will attest to, I think is one of the hardest one to diagnose, right? And normally when it's discovered, it's always like at very late stages, but I don't know if technology, maybe things have gotten better, right, Doc? So Doctor, when it's all you.
Thank you again. I think I would have been offended if you had allowed me to speak before these beautiful women. You know, these survivors, these conquerors, these women who are heroes and a champion for all our women who suffer from cancer. So I'm happy to have been associated with Dorothy Phillip for many years now. I am a medical oncologist. I have been in St. Lucia since 2004, practicing initially at the Victoria Hospital in the public sector and privately in my own office in the Tapio area. And, you know, sometimes at St. Jude and elsewhere. So, you know, I have collaborated with Faces of Cancer over the years during health fairs and so on. And, you know, other organizations that, you know, champion the cause of fighting cancer in our country, as well as throughout the region. In St. Vincent, I assist the support organization there, Scorch, and Antigua, Dominica as well. So, you know, oncologists are very few in the region. So we try to extend our support throughout the islands. I'm very happy to be part of Bouyon's education sensitization program for World Breast Cancer Awareness Month.
Thank you very
Thank
much.
you for having me.
Let me ask you, Dr. Gabriel, are you St. Lucian by any chance or no?
Oh, 110%.
Okay,
If that's
I was
possible.
wondering, you know. Okay, cool. Thank you. So you see, we have talented St. Lucians as well, right, guys? All right, all right. So thank you guys so much again for being part of Bouyon, and I'm gonna start with you, Dr. Gabriel. I know at the beginning of the show, I played a YouTube video about understanding cancer because cancer is complex. And I just want you to give our viewers an idea of what is cancer before we dive into the main discussion. Tell us a little bit about what cancer is all about.
I mean, I'd say that cancer is a dreadful disease. Cancer is a disease that is characterized by the formation of cancerous cells, what we also call malignant cells, that usually form in any tissue of the body. In the case of breast cancer, it's the lining of the ducts and lobules of the breast, the glands of the breast. These cells form, they multiply in an abnormal, in an uncontrolled, and an accelerated manner. Eventually, they develop support systems for them, blood supply, a tissue to be embedded in, and eventually it becomes a tissue. When layers of tissue form over and over, eventually it becomes a tumor. And that is when we start seeing and feeling when that cancer starts to invade the surrounding tissue. So eventually it starts initially on the surface of and the lining of our tissues. And at that point, you are asymptomatic, let's say, until that becomes a tumor over time, and that tumor starts to destroy surrounding tissue. It has its blood vessels, so it feeds itself, it grows, and you start feeling the other effects. A lump maybe is the first effect you might feel. Eventually you might feel some pain. There might be some bleeding. There are nodes around the area, the lymph nodes that was in your video that you presented. Perhaps you may understand this better if I explain, you would understand that we all, the fertilized egg grows into a human being, not so? So our bodies have genes that code to allow for growth. But because there must be a balance in life, growth, there are genes that also suppress growth. So you don't want anything to grow in excess. So a cancer grows in an abnormal, uncontrolled, and accelerated manner that is uncharacteristic of normal tissue. So it grows faster than normal tissue. And this is because either the genes that control growth are abnormal genes, mutated genes, or those that suppress growth are unable to prevent the excessive growth of that tumor. So at the end of the day, cancer is about cells that are abnormal, malignant, that grow in a way that is uncharacteristic of normal growth patterns, controlled growth, and eventually death. Because our cells grow, live up to a certain period of time, and then die, and new cells are formed. Cancer seems to have an unending lifespan. They're almost like immortal cells. Sometimes people have described them as immortal cells.
Okay. Thank you so much, Doc. I think you've put it plain. I mean, I've understood it, and I have a hard time understanding medical terms, and I have understood what you've said. So thank you so much. What I want to say here is, and I think my conversation with Sharon, and we spoke for a little while back. Cancer is not a death sentence, and you ladies here are testament to that. And what I'd like to give each of you the opportunity to speak about your experience. Maybe we can start with how were you diagnosed, or what caused you to go and check, and you know, so that people out here, because the aim of this panel, the aim of this live or this Zoom call is more about educating people out there so that they are not afraid to get tested, and for them to know that if they are suffering or if they've been diagnosed with breast cancer, it's not a death sentence, and that they can fight and that they can survive. So Sharon, I want to start with you. Tell us how, give us like your journey, you know, how you were diagnosed or what prompted you to actually go to the doctor and get tested. I don't know if she's frozen.
I and stress this I used to
I think we
I
haven't.
have you know,
I think we
are
having
you hearing
some
me?
issues with. I think I don't know if it's your internet or your connection is bad. I think.
Are you hearing me now?
Yeah, I'm hearing you now. Yes.
Okay. I have breast, numerous cysts in my breast. So every 6 months, I used to drain the cysts out of my breast. I used to do a mammogram, sonogram every year. 2016, I had a mammogram and a sonogram, and I was told to come back in a year's time. About August, I felt a lump, but because of the dense breast, my breast surgeon always tell me monitor the lump. It was not going down, so I had a sonogram. And with that sonogram, the pathology told me I have to do a biopsy. But in doing the biopsy, she actually sent a technician to wait for me by the door so I can make the appointment for the biopsy. I'm like, okay, something is wrong, something is not right, but I still did the biopsy. And eventually she called me. I was on the train. So she kept on calling and we missing the call. So I actually got off the train and I told her, she said, no, when you get home, call me. I said, no, you called me for a reason and I need to know exactly what. And all she said was, you positive. And I made all the appointments for you. I took it, it wasn't hard for me. I mean, I accepted it because I knew something was wrong. So it wasn't a shock to me when she said I was positive. But when I went home, I was alone home, so I cried. And that was the only time I ever cried in my life with breast cancer. I never cried again.
Wow. Okay. Thank you, Sharon, for sharing that with us. Dorothy, tell us your story about how you were diagnosed. I think you're on mute. I think you're muted. I think you're muted, Dorothy. I think you're muted.
Okay. All right. My story is one of where I like to tell people be wary of persistence. In that I saw a little bump on my breast that looked like a mosquito bump. And after 6 weeks, that bump was still there. So for me, that bump was persistent. So I went to the doctor and I'm like, you know what? A mosquito chose all the way on my breast to bite me, and it's not going away. And so she's like, oh, let me take a look at it. And she looked at it and she said, oh, you had it for 6 weeks? I'm like, yeah, I had it when I was in the US and I came to St. Lucia and it's still there. And she said, okay, well, I don't think it's anything because I just did a clinical breast exam for you 3 months ago. I don't think it's anything. There was nothing there, but let's be safe and biopsy. And so I had it biopsied and it was cancer. So it took a long time for them to tell me it was cancer. So I was very upset and I decided to go back to the US because I had just moved back to St. Lucia 2 years prior to that. So I decided to go back to the US and have it taken care of.
Thank you very much. Thank you very much, Dorothy, for sharing your story. And I could imagine, of course, you'd be upset if it take a long time to get a result of of a test that was done. Dr. Gabriel, Tell us, how does one find out that they have breast cancer? What are the normal screening processes that they use to identify or to kind of track breast cancer?
Well, thankfully, the majority of women who are diagnosed with breast cancer discover it themselves. And that's because women, understand their breasts better than any doctor could. And it's important to understand the breast because it's the changes in whether it is the shape of the breast, the contours of the breast, the skin changes, the color changes of the skin, the texture of the skin, whether you have a discharge from the nipple, the nature of that discharge. Sometimes you may have glands developing under the armpit. So, the most common manifestation of breast cancer is a lump in the breast or thickening in the breast, which women discover. Now as doctors, we prefer women to be diagnosed with breast cancer, if at all they're going to be diagnosed, when you cannot feel that lump yet, before you feel that lump. So usually through what is termed a screening mammogram. But we'll come to that in a bit. So a screening mammogram will pick up a lump in the breast the size of a lentil, let's say. It's not perfect, but it will certainly pick up a lump way before you might be able to feel it yourself. And the earlier we diagnose that breast lump or that breast cancer, the better the outcome with treatment, the more successful the treatment interventions. So a lump is the first thing that we see, a lump or thickening of the breast. This is the first thing that we see. Sometimes there is a change in the size of the breast. We know that both breasts are never the same size. But what you have seen is a change in the size of the breast. And this we will see if we are able to examine our breasts monthly. We suggest to women who do that breast examination that they do it a week after the period, after the cycle, so that the hormone influence is less on that breast. Because when the hormones are, throughout the month when the hormones are in the highest levels, the breast tissue changes and it might confuse, most breasts are lumpy in effect. So you wait for a week after that cycle. So alteration in size. And I suppose at some point we'll talk about examining your breasts. And I always say it's very simple, looking and feeling. So if you look, you might see that change in shape and change in the size of the breast, or change in the appearance of the breast. That skin, is it red? Is it darker? Is it scaly? Does it look like it has a rash? And so on. The changes in the skin, the appearance of that breast. Is the nipple pointing to one side? Is the nipple pulled in? Or is it inverted? Right. All of these things tell us, that something is happening to that breast. And this is a manifestation of that cancer. And as I explained earlier on, that cancer is a formation of cells that grows in layers, eventually becoming a very complex mass that then invades the tissue around it and in that way pulls that tissue into its own area. And therefore, if it pulls that tissue, the skin and the surrounding structures around that breast also change shape and color, right, and so on. Sometimes that breast cancer eventually affects the skin, causing an ulcer or a sore on the skin. Sometimes you have a swelling of that skin that looks like an orange fruit skin. It has what we call pitting and dimpling. So these are signs of the changes in the breast and so on. We have the nipple and the areola, which is that dark rounded area that's below the nipple, as you saw in your video. It is important to be able to identify, looking at that breast, seeing those changes, and then feeling that breast. Feeling with that, your 3 fingers, starting, if you want to use the clock at 12 o'clock and going all the way around, in circular motions. I say to people that what you want to do is at 3 different levels of the breast. Eventually, gently at 12 o'clock, just on the surface of the breast, push down a little, another circle, like a dollar coin, and then very deep into the breast. So 3 circles in the same spot. And then you move on to the next area. Let's say you go to 1 o'clock. Again, 3 circles, push down a bit, and then another circle. So you look at the surface, the mid portion of the breast tissue, and then the very base of that breast tissue, all to your pectoral muscle. And then you're moving across, and you notice I am not moving my hand by lifting my hand off the breast. I am moving my hand by moving the fingers. So this last finger always overlaps the last finger that we had on the breast. 3 circles, and you go all around,
So you're not
identifying the whole breast tissue. And eventually you can milk that breast to see if there's any discharge from that breast. But you're milking from outside in and outside in all angles. And eventually you want to examine under your arm and the collarbone area at the base of the neck. So that examination should not be less than 20 minutes. If you spend 10 minutes on each breast, that's a thorough exam.
Right.
Once a month. So these are the signs that you see in that breast, looking and feeling for changes in that breast tissue. And these are how the majority of breast cancers are diagnosed.
Okay. Thank you so much, viewers. You heard, and it's an easy test, self-examination, how you do it. And Dr. Owen just demonstrated the way to examine your breast, to have a self-examination. And if you think there's a lump there, then you should not hesitate and go to your doctor to get it checked out, just to make sure that it's not anything serious. Dorothy, when you were initially diagnosed with, you said you went back to the US because you were taking too long. You went back to the US, I guess you went to your doctors, then they diagnosed, okay, we think it's breast cancer. When you were diagnosed, what stage were you at, and what happened thereafter?
Okay, well, I was diagnosed between a 3A and a 3B. Because of the way I was treated, they couldn't tell me out front whether it was 3A or 3B. All I was told was from the doctor's professional opinion, it's between a 3A and a 3B. And I was, I was a matter of fact, because my personality is one that things rush off me like rainwater. I didn't cry about it. I did not pine about it. It was like, okay, what's next? What are we going to do? When can we start? So my journey was kind of not like everybody, because everybody talks about how they cried and they fell down. But for me, it was like, okay, what next? I never for once felt that I was going to die. In St. Lucia, when I was told that I had breast cancer, I said, okay. And the doctor actually asked me, did you hear what I said? And I said, yeah. And he said, did you understand what I said? I said, yes, but you didn't say I was going to die. And so I never really equated me having breast cancer to death. I always equated it to surviving and let's go. What's next? Let's do what we have to do.
Thank God for that. You're here today, so thank God and praise God for that. Sharon, you indicated that you were free positive, triple positive.
I am triple positive.
Can
I am
kind of explain to us. Sorry, we having a. Can you kind of explain to us what triple positive means?
I am estrogen positive. I am what's it, how to say that? Just 1 second. Progesterone positive, and I am HER2 positive. HER2 is one of the aggressive forms of breast cancer. It can be, yeah, but that's a 3 positive, and I'm stage 3, but 3 positive.
So you are at stage 3. So when you got the news, how did you really feel, and what happened right after the news?
I did not feel anyway. I was expecting, as I said, before I did all those exams, the way the pathology was acting, I knew something was wrong. So telling me I had breast cancer was not a shock to me. I accepted the news because my aunt was already, my aunt had breast cancer. So I followed her example. She was positive, and I continued to be a positive person. And for breast cancer, you have to be positive.
Yeah.
Negativity is zero. So positivity is the best thing to do.
She is a very positive lady, very positive. Dr. Owen, let me ask you, if a doctor says, hey, you have breast cancer, do you recommend someone getting a second opinion? Or in what cases would you advise getting a second opinion?
Well, absolutely. I think, a second opinion is always warranted once you're dealing with cancer. There are so many issues, so many factors influence the treatment pattern. And I'm happy that Ms. Callender brought up the issue of her being triple positive breast cancer. Many years ago when I started studying oncology, we knew very little about breast cancer. We just knew it was a pathology, a diagnosis that we would have. However, as time has gone on and science has become more sophisticated, we have understood that cancer is not just on the surface. The molecular nature of cancer is important to know, which will allow us to treat it adequately. If you realize, she has mentioned estrogen, progesterone. Those are two female hormones that women, produce a lot of as being part of a woman. And these two hormones allow us, because it means that breast cancer will respond and grow in the presence of excess estrogen and excess progesterone. We are then able to give medications, namely something called tamoxifen, which will inhibit the estrogen itself. And there are other types of drugs, for instance, Arimidex and Femara, which are given to prevent the production of these hormones. So one drug inhibits the production of the hormones, and another one prevents it from acting on the cancer cells. And the third, HER2 protein expression is very important because we are now able to do something called targeted therapy, which means that we are able to give medications that directly target these cells, these breast cancer cells that overexpress this protein. So, a long time ago, people would say that chemotherapy kills good cells and bad cells and so on. So we're now able to give drugs that, like a sharpshooter, will target those particular breast cancer cells and kill them and allow other cells to proliferate and grow in a normal fashion. So,
it's very good to know.
So this is important to know because it will be important to say that the opposite of what she said is a very important type of breast cancer, what is called triple negative breast cancer, which means that you are estrogen negative, progesterone negative, and HER2 negative. That, as you would understand from what I've explained, is one of the most aggressive types of cancers, one of the most difficult types of cancers to treat. And unfortunately, we find that this kind of cancer tends to be common in younger women, tends to be common in Black women, tends to be common in Hispanic women, and therefore also has a higher or a lower survival rate because of how aggressive it is and because we cannot target it in a particular way as we could target the treatment of triple positive breast cancer. It's important to know that scenario as well. I'm also happy that you mentioned that your aunt had breast cancer. And some people are of the notion, which is erroneous, that the majority of breast cancers are inherited, which means transmitted from generation to generation, unfortunately. And, the majority of breast cancers are actually sporadic. So maybe 5 to 10% of breast cancers in women are hereditary breast cancers. And maybe up to 20% of breast cancers in men tend to be hereditary breast cancers. So the very famous example that we have of where family genetics come into play would be that of Angelina Jolie, who was tested positive for a gene called the BRCA gene, the breast cancer gene. And she was tested positive for it because her mother had breast cancer and was tested positive for that breast cancer. And because of this positive test, Angelina Jolie thought that she might prevent herself from getting breast cancer by having a prophylactic mastectomy, which means she removed her breast tissue before having breast cancer because of the higher risk of having breast cancer owing to the presence of that gene in her system as her mother had had breast cancer. So if we know this gene, and there are a number of people who are at risk of having this positivity, and just so that you understand, there seems to be a link of triple negative breast cancer and that BRCA gene. So we have found that there's a very high incidence. About 70% of people who are BRCA positive are also found to be triple negative.
Oh, wow. Whew. All right. That's a lot of information and a lot, you rocked me there a little bit, but I have a question for you, Doc, and I'm gonna ask the ladies about their support system when they were diagnosed, and I will go first with Dorothy, and then when Dorothy is done, then Sharon, you could continue and answer. But Doc, I kind of want you to kind of think about when people are diagnosed, what then is the next stage? So when they answer the question, that would be my question to you. What is the next stage? So Dorothy, it's all yours. Tell us what your support system was like, what you did, how you dealt with it, and how your support system was. And then Sharon is about you now.
Okay, so my support system was basically my family, my husband and my 4 sisters. We had always been very close growing up, me and my sisters. And so when I did get cancer, my sisters were very supportive. Even some of my sisters that are not the same mother with me, they all flew to Georgia to support me. It was always a party because we like partying, and my sisters were always there. Every week, a different sisters coming over. So it was a lot of fun for us. And of course, my husband was there to help me drain my, milk my drains and go to the doctor with me and so on. So my support system was there, but it was basically my family, and my kids and my grandkids came over to see me quite often. So I was always like around family. Because before that, I had not lived in Georgia, but I did get my treatment in Georgia. I had 2 sisters over in Georgia. So you find that my family was my main source of support. Although being in Georgia, there was other support offered. Like there were support groups, support communities, but I just kept to my family because I'm a very family-oriented person.
And Sharon, you?
I had one of the greatest support system. I had my family, friends, my bosses, my co-worker, my church. My oncologist was a good support system too. So I had one of the greatest, I cannot regret it. And I put my trust, I had one of the most high is the Lord. I put my trust in him. And I always say cancer is not a death sentence, and cancer is not. After my first surgery, my lumpectomy, and I had my lymph nodes removed, 2 weeks after that, I celebrated my 50th birthday. I had a good time, and I never, well, my family never allowed me to think of breast cancer. They treated me like the same person before I had cancer. For that, I always give them praise and thank you, and I always say thank you.
Let me tell you, you have the greatest man in your corner. Once God is there, you will survive, and God is good. Doc, just as I was asking as a question, like, you've been diagnosed, you're down, you're depressed, you don't know what to do, right? The world seemed to be shutting down on you because, I could imagine, just being diagnosed. If this is a hard blow, because you're thinking, what is happening? What is going to happen at the end of the road? What will happen to me? And can you tell us what is the next step when someone gets diagnosed with cancer? What is the next step? What do we do next?
I do have to say that I'm so elated that both Dorothy and Sharon, have had for me what is a pillar for a successful outcome in breast cancer treatment. That is the family support, that strong, positive environment, that environment of optimism, of hope, of successful treatment plans and so on. So once somebody is diagnosed with breast cancer, it doesn't stop there. What we must do are all these other tests that allow us to determine the exact nature of that breast cancer. We do these markers, for instance, those testing for those receptors. We test for certain genes in that breast cancer, genes that make the cancer more aggressive or not, genes that may allow us to target certain immune factors of that breast cancer. So the pathological testing of that is not just something that we do under a microscope. It goes way beyond that, where we do something called immunohistochemistry, which are sophisticated tests that determine the molecular components of that breast cancer. Then, after the pathological testing of that breast cancer, there is all the radiology testing. So a mammogram is important. A mammogram allows the doctor to understand the breast tissue, understand the context of that lump. Is it a single lump? Is it one large lump with several smaller lumps? Is it a lump that is not defined by a dense area? Is it just microcalcifications? Which will help the surgeon then determine the kind of surgery you might have. Sharon said that she had a lumpectomy. And the two surgical options are usually either the lumpectomy with the lymph node dissection, or a mastectomy where the entire breast is removed. So the lumpectomy is just an area of that breast. Usually, once you have a lumpectomy, you will need to have radiotherapy. So it's important to be able to characterize that breast cancer, to know exactly what is happening with it. So we've done the pathological tests, we've done the immunohistochemistry tests, we've done the radiology tests, and in the radiology test beyond the mammogram, most patients will need CT scans to determine whether that breast cancer has spread beyond that breast into other tissues like your bones, your lungs, your liver, the brain. And this will then lead us into determining the staging of that breast cancer. Is that breast cancer a localized breast cancer, albeit stage 1 or stage 2? Or is it a regional breast cancer where it's more than just the breast lump, the lymph nodes are involved, the skin is involved, the other surrounding tissue is involved? As you saw in the video presented, stage 3, when you start seeing sores on the skin and so on. Or is that cancer a stage 4 cancer when it has spread to other organs of the body, the vital organs of the body, and therefore we know that the survival is very much reduced, and the treatment may not be with curative intent, but rather a palliative intent, meaning that we are improving the quality of life of the patients, we are reducing pain, we are making that person lead an acceptable life with their friends, families, and co-workers in the context of a disease that cannot be cured at that point, but we contain it within the staging of it. So all of these things are done to be able to come to a conclusion as to how to treat that breast cancer. But importantly, and this is what I've liked so much that has been brought up, the psychological components, the psycho-emotional components of breast cancer treatment. So we usually want these patients to be counseled by a registered and trained psychologist or counselor. Their families have some kind of intervention as well in that manner, which will allow for those patients to go through the treatment in a more convenient, healthy environment, let's say, where there's less trauma, emotional trauma, psychological trauma, and we enhance the positive nature of the family unity and the support mechanisms of that patient through psychologists and counselors. So it is not a simple thing of diagnosing the cancer, going into surgery, getting chemotherapy, getting radiotherapy, and it's done. We must characterize that cancer and provide and assist that patient in building their strengths and sort of neutralizing the weaknesses in their whole outlook and perception of that cancer and how it relates to their well-being. So it's not just what doctor to patient, but a team of experts, dietitians, nutritionists, physiotherapists for rehabilitation, who will act in beyond the diagnosis in getting that patient to be well equipped to deal with the cancer throughout its stages of treatment.
Wow, thank you, Doc. I mean, a lot of information, a lot. To be honest with you guys, I mean, it's a lot, and I want to thank everyone who has joined us in this on Bouyon tonight. We have guys. I'm not ignoring you. It's just that there's so much to get to talk about. There's so much I'd like to ask. So many questions I have. I have like 1,000,001 questions in my head, right, Dorothy? You know that. So I have so many questions I want to ask, and I just want to tell you guys, be patient with me. I'm not going to be calling their names out tonight, but I want to thank all of you for tuning to Bouyon and listening to us. We have in the house with us tonight, we have Dr. Gabriel, who's the I almost say he's the only man, but he's not. I'm the second. I'm the host, but in my guest, we have Dr. Owen Gabriel, we have cancer survivor Sharon Callender, and we have Cancer Survivor Plus, founder of Faces of Cancer St. Lucia, Dorothy Phillip. I want to thank all of them for taking the time to be on the program with us tonight and sharing with us the experiences, and of course, Dr. Owen sharing his knowledge as well. Dorothy, I know we've spoken a couple times, and you've given me an account of the many surgeries that you've had. I'm sure you're comfortable talking about it. So I'm going to ask you, tell us a little bit about the fact that when you're diagnosed, the amount of surgeries that you've gone through, what life was like, how did your life change? I know Dr. Gabriel alluded to the fact that it's about changing a lot of aspects of your life. He spoke about the dietitian, is that we need that you probably need to change your diet. You probably need to do things that you were doing before. You probably need to do them differently. So tell us a little bit about that experience, about all of the numerous surgeries that you had to go through, and what sometimes may have looked like almost the end of the road, but you still survived and you made it through your hard times.
Yeah, so my first surgery actually was to do a core biopsy and to remove my breast. After that, it so happened that for some reason, the surgery kept opening up. And I had to go back into surgery again. They had to graft skin, put skin to kind of help heal out where it was opening. Then after that, after I did the radiation, I got badly burnt by the radiation, and that further damaged my skin. So I had a hole the size of a dollar coin at the side of my breast. That just burst out one day. My skin was so damaged that I looked in the mirror and I just saw a hole, and I was like, holy. Call the doctor, get me back in surgery, some more grafting, graft out that hole. So it was a constant in and out for my skin being badly damaged from the radiation. Then when I did reconstruction, and I kept having, how do you call it? There's this film that grew over the saline bag. We call it a capulectomy. I kept having capulectomies. I had about 4 of them, because every time they take it out, the implant, put in a new implant, another one would grow. So all of that contributed to the numerous surgeries that I had. My last surgery, actually, praise God, I haven't had another one, was in 2014 when I had my last capsulectomy. And I said to the doctor at this point, if I have to come back one more time, I think you need to take off both breasts and I will go as a man, because I'm getting a little tired of this thing. Knock on wood, I haven't been back since then. But I went through a number of surgeries because of that. Yeah.
Wow.
Changes. I've had some good changes in my life, I must say. And I tell people all the time, cancer didn't happen to me, it happened for me because in a lot of ways it changed me. Before cancer, I was a facility manager by profession. I also did construction management by profession before cancer. And here come cancer, and I have a totally different outlook on life. And I'm doing Faces of Cancer, which is voluntary. And I feel very fulfilled in it. It's not a paying job, but life is not about money all the time. It does bring a lot of happiness. That is what I want to do. I want to assist others going through that journey because I made it out okay. I would like to see everybody make it out okay, although I know that is impossible, but I will try my best to give everybody a better outcome, as best of an outcome as I can. So there were a lot of changes in my life in terms of profession. I studied a lot. I did health management, I did health economics, I did NGO management and patient navigation for for breast and pancreatic cancer. So I did a whole professional shift to better help me help people going through cancer.
Wow.
In terms of diets, originally my diet did not change. I always ate everything in moderation, but recently I've had a series of food intolerances and I've had to take off some things out of my diet, but not because of the cancer. I would gladly eat everything that come in front of me. Um, Eating for me, everything in moderation is the way to go. Once you eat a healthy diet, once it's a healthy food, it's fine. But nothing came out of my diet for the last 12 years. It's only the last 2 years since I began developing the food intolerances that I
That,
have
that
taken things out of my diet.
that's why you look so good because you eat everything in moderation. Tell you that's the secret right to it all. So Sharon, tell us, when you're diagnosed, what was your biggest self-discovery after or revelation rather when you were diagnosed? What was the biggest thing?
Okay. My biggest, like, I felt like cancer taught me that life must go on. It taught me that I am stronger than the person I think I am. With cancer, with diagnosis of breast cancer, it has helped. My faith has been stronger. Every day, every night, I praise this man above because nothing is impossible with him. And I believe he is one of the reasons I'm still alive. And also, it helped me. I speak about cancer now. I encourage my friends. Like, I'm just encouraging my friends that you should have a mammogram, you should have a sonogram, do self-breast examination. I always tell people cancer is not a death sentence. So for me, it put me out. I'm bolder than what I used to be. That cancer is, I mean,
You
I can tell
definitely
people cancer is not a death sentence. You can live. They have treatments and treatments because I went through so many treatments and I'm still going through treatment. So
right. You definitely have become bolder, to be honest with you. I remember the Sharon I knew 25 years ago is not the same Sharon today. So yes, you've definitely become bolder, and thank God for that. And I know having our conversation, one of the things you say to people is you say you need to talk about things that you're going through sometimes, because sometimes you think you're alone in this, but you're not. And somebody may offer a word of advice. Somebody may say, oh, I went through this, or a friend went through this and they did X, Y, and Z, and that will help. So it's important sometimes to share your story. I know some people, I was speaking to your aunt and she's like, Sharon is so vocal about this, but I'm not, because she had been through, when she called me and said, Peter, I was diagnosed with breast cancer. I was like, what? And it was like a shock to me. And we had the conversation. And then, of course, as she was going through treatment and doing the things that she was doing, it was, so. And she's not. And I was telling her that I spoke to her about 2 Sundays ago, or last 6 Sunday it was, and was telling her that you were going to come on the show. And she was like, yeah, Sharon is so vocal about it, but I'm not. I'm more shy and so on. So I thank God for you and for being able to share your story and for other people to be educated and to do not think of if they have been unfortunately diagnosed with breast cancer, don't look at it as something that's impossible to overcome. Having said that, Dr. Owen, I want to ask you, when we talk about the treatment of breast cancer, is it like one size fit all in terms of a treatment, or is it tailored towards a certain individual? So depending on what you have, I tailor your treatment to this or whatever. So tell us a little bit about that.
Absolutely, a wonderful question. I mean, it's so important that we have these discussions, especially among the community that we're targeting at this point. You know, I mean, I don't know if you guys recognize it, that this year the World Health Organization has said that female breast cancer is now the leading form of all cancers, the most commonly diagnosed cancer in the world now, even more than lung cancer, which used to be the most common cause of cancer in men and women. And I mean, you know, as we speak, every 13 minutes, a lady dies of breast cancer in the world. Can you imagine that? So it's important that we have this discussion, and as breast cancer, the type of breast cancers have changed over time. As we've discovered new types of breast cancers, and as I mentioned earlier on, triple negative breast cancer, the treatment of breast cancer has changed. In the initial phases of breast cancer diagnosis, the mainstay of treatment would have been surgery and surgery only. A lot of women, when I came to St. Lucia, had just had a mastectomy, which maybe at the time would have sufficed for the kind of breast cancer that that person had. But as we've seen breast cancer changing in its nature, because more aggressive types of breast cancer are being discovered, the type of treatment, again, as you have correctly pointed out, we now do individualized treatment. So it's based on that person, based on the person's age, based on the stage of the breast cancer, based on the receptor status of that breast cancer, based on whether that person lives a certain lifestyle, let's say. So one might choose radiation versus surgery. One might choose surgery and reconstruction. One might choose a combination of chemotherapy first, prior to surgery, what we term neoadjuvant treatment prior to surgery. Or one might choose to administer hormone treatment because that breast cancer, as had been pointed out earlier by Sharon, is triple positive. In that case, it's estrogen positive, progesterone positive. We might be able to give hormone treatment. And now with the new types of treatments, we have immune therapy for breast cancers, where we give medications that help our immune system target that cancer and kill those cells. And we are able to target particular enzymes in the breast cancer proliferation phase that we can inhibit. We can stop these enzymes with certain medications in targeted therapy using antibodies, monoclonal antibodies. Sometimes, as we had mentioned in the case of Sharon, she might use something called Herceptin or trastuzumab, which will target her breast cancer in particular and kill those cells because they overexpress a particular protein in that respect. So the profile and the range of treatment options have increased exponentially over the years for getting a better outcome. So whilst we have had an increase in breast cancer incidence and so on, and the more aggressive breast cancers, we've also had an increase in the array and options for treatment for breast cancers around the world. We do have to recognize that in ethnic minorities, we have certain types of categories of breast cancer that are more aggressive, and the question of access to treatment becomes an issue in these minority groups, and that leads to worse and poorer outcomes, which means we know that mortality for breast cancer is 40% higher in Black women when you compare them with white women. 40% higher in Black women.
Wow.
So we need to have these kinds of programs, and I'm so thankful that Bouyon is affording us this opportunity tonight to reach out to our community and around the world to speak to breast cancer and the need for women to be vigilant of your health overall, and particularly of breast cancer, not only in the month of October, but throughout the year, that you're doing your breast self-examinations, visiting your doctor for clinical breast examinations, and having that annual mammogram, if that's the case in your respective age groups, because sometimes it can be every 2 years, depending on your risk factors, and other tests that are necessary for ensuring that you have the best outcome possible if you are diagnosed with breast cancer.
You know, Doc, thank you so much. You know, one of the things that really stood out to me, to be honest, and when you were speaking, is the fact that, you know, I always thought of when we have cancer and we have to take chemo and so on. It's always about, you know, perfect cells are dying as well, and you're poisoning the body, and you know the good cells are gonna die, and I'm happy to hear that you have pointed out that the treatment that actually target the bad cells. I heard right? That these treatments actually target the cancer cells, right? I heard that, right? I did hear that,
Absolutely,
right?
you absolutely did.
Okay,
Okay.
I just want to make
Yeah.
sure and want to tell the individuals who are listening that they heard what I heard. That, you know, we always think about when you having or treatment for cancer, you know, we always say your good cells dying too, and the bad cells dying, and the good cells dying, and all of this. But now I'm happy to hear that there's treatment now that actually targets the bad cells. Dorothy, your life has changed. You've moved from being a facility manager, right, to
Yeah.
being involved so much in cancer and all of that good. I say all of that good stuff because it helps people and people, you know. And I want to talk a little bit before the show ends. I want to talk a little bit about Faces of Cancer St. Lucia. We'll talk about that a little bit. But before we go into that, I want to ask you, can you, like, you know, when someone has a diagnosis of cancer, you kind of feel that your life is now on hold, because now you feel all the dreams that you've had, everything that you desire to have is now on hold, because you don't know if you're going to make it, right? You don't know if how tomorrow is going to be. You don't know if when you start taking therapy, you start taking chemo, you start doing whatever, you don't know if you'll be able to wake up to go to work the next day, right? So in your experience, what was held back in your life because of cancer, and kind of how did you deal with that?
What was held back because of cancer? Um, I would want to say my job. um, you know, I never felt that my life had to go on hold because I was not sure of the future. Because I used to read a lot of spiritual books. Eckhart Tolle was one of my best writer. And so I had a different attitude towards the whole thing about living and so on. And when you say your life on hold because you don't know the future, but you don't know the future either. Even if you don't have cancer, you could walk out of the studio and you get hit by a train.
That's true.
So
I hope not.
So it's not, I didn't look at the whole cancer thing in that way. One thing I can tell you, when I did have the cancer, I kept to my spiritual self, but I never asked God for healing. And up until this day, I have an issue when people pray and they ask God to heal them. I never did ask God to heal me. I asked Him to have me inspire other people. And that is exactly what He did. Because I figure out when it's time for me to go, no matter how many times I ask Him to keep me here and heal me, it's time for me to go. But my prayers were actually to fill me with love and to help me to inspire other people. That was all I was asking for, never for healing, because I don't know, that because of the type of person I was. I never ever thought that I was dying. So I knew I would come out.
Praise God for that, right? And He answered your prayers, and He's
Yes, He did.
placed you in the right position, the right place to help people, and that's what you're doing. And thank God for that. Sharon, I want to ask you in terms of your treatment, because I had an aunt who what about, I think it was in the US 10 years, I think 5 years ago. she was diagnosed with breast cancer, and she's a devout Christian, you know, and she prayed a lot. But one of the things I remembered when she was going through her chemo and going through the process, this lady, when people were saying that you'd be sick after chemo, you'd be weak, you can't do a thing, she used to come home, cook, go to the laundry. And I was like, how do you do this? And she was such a strong person doing all of these things and taking treatment. And I look up to her and I say, you know what? How do you do this? And she only tell me, God. God. That's all she says, God. God gives her strength, and God allows her to do the things that she's doing. And so tell us, in terms of your treatment, tell us some of the challenges or difficulties that you've had, and how were you able to overcome those?
With my treatment, I never had difficulty, to say difficulty. With my with chemo, I had 4 drugs taken. So I had TCHP, it's 4 drugs taken for 3 hours. And the only time I never worked was the day of chemotherapy. I worked throughout my whole entire treatment, and my entire treatment. My first chemo treatment, the taste in my mouth was like metal. It tastes like the smell of metal. My second treatment, I could not eat anything sweet. Sweets were like, no. My third treatment, I started getting, I was still walking. I'm a walker, so I continued walking. But my treatment was on a Thursday. The Friday, I was getting a injection, what do you call it? But it's something to help you with your bones. And that drug, day 3, I would be down for the whole day. That was the whole day, because it affects your bone. But I did treatment on Thursday. I took the injection the Friday. The Saturday, I was in the gym. So it never brought me down. I never did anything to say, the treatment, everybody is different with chemo. Some people say, oh, chemo is bad and whatever. No, you have to be in chemo, take chemo to know how chemo affects you. Chemo affect me, it got my body weak, yes, but I still push on. Because my oncologist tell me you have to fight it, people don't eat when they take chemo. Even if my mouth did not have appetite, I ate for eating sake. And you can do it. I mean, you don't listen to what I always tell people, do not listen to Google doctors. People go to Google doctors and just read everything. No, you have to try things for yourself. You try it. If it works for you, it works for you. If I'd listened to other people, I would not be taking chemo. And I took chemo before I did a mastectomy, because they had to destroy the cancer cells before. And I did it. You can do it. You just have to put your trust, believe. I mean, there are things, and you can go through things. Don't listen to people. You have to do it on your own. If it works for you, yes, but to just listen to people, no.
Thank you so much, Sharon, for sharing this. Doc, let me ask you, because Sharon was talking about chemotherapy, and I know initially we were talking about how the medication to actually target the bad cells. Is that the same for chemotherapy, or chemotherapy also destroys the good cells as well? Or, I'm just trying to understand.
Well, cancer cells are, as we had said initially when you asked me to define cancer, are cells that are growing in an abnormal, but also an accelerated, uncontrolled manner. So chemotherapy in general targets cells that grow faster than normal cells do. So there are different tissues of our body where that happens. Like the lining of our gut, the hair follicles, and so on. That's why you may have hair loss when you take some chemotherapy drugs. So it's not all the good cells of the body that are targeted. If the majority of the cells of the body are not affected by chemotherapy. Only those cells where you have fast-growing cells normally in the body that may be affected, and not all the time. As you would have heard, from Sharon that her side effects were nothing to immobilize her and prevent her from living her normal, doing her normal activities, as it were. Everybody's experience is different. So we need to know that now with current treatment protocols, we are able to neutralize and mitigate against the adverse side effects of chemotherapy. So, there are interventions to reduce hair loss. There are interventions to prevent people from, becoming anemic, treating the low white blood cell counts, preventing these adverse effects that are considered, terrible for patients as far as the experience with chemotherapy. We have come a long way. Vomiting, for example, which is one of those side effects that is common, we are able to administer treatment to prophylactically to prevent vomiting. So there's a number of things that we can do. And in the case of Sharon, we had a combination of chemotherapy and targeted therapy. So therefore, the adverse effects, the combined adverse effects are much less, whereas if it were just chemotherapy in isolation of the targeted therapy. So we have a better outcome, a better response, because we target a larger group of cells with less side effects at the end of the day.
Thank you, Doc. Thank you. Dorothy, I want to ask you a little bit about Faces of Cancer St. Lucia, that organization. I know you're the founder of Faces of Cancer St. Lucia. So tell us how that group came about and what is your mandate currently?
Okay, so I did all of my treatment in Atlanta, Georgia, and it was an eye opener to me, because when I walked into the facility, nobody looked like they were dying. I mean, people were looking out for each other every time you go there. Where's this one and where's that one? People walking in the bag of snacks, we sharing, we giving jokes. I'm doing my knitting, some people playing cards. It was just a different atmosphere. It just gave you the feeling that it's like a familyhood, a club-like, we look out for each other and we're just happy to be there. And so I wanted to bring that same experience to St. Lucia. So people will not see chemotherapy and cancer as something bad, but they will look at it as a familyhood to get together and to be positive while they're going through their treatment. So in 2010, when I returned to St. Lucia after my 2 years of ordeal, I started Faces of Cancer St. Lucia. But before I came back to St. Lucia, I used to attend a support group that my doctor was part of, my oncologist was part of. She had asked me to join the group. And the reason why she asked me, because she said to me, everything that could possibly go wrong with a cancer patient have gone wrong with me. And she said I would be a good advocate to be in a cancer support group. I had diabetes, I had glaucoma, I got Bell palsy, I got everything you could think of that could have gone wrong during my treatment. And so I went to 3 sessions with her group. And then I told her, I think I want to do the same thing in St. Lucia, because if I can do it for people in Georgia, I can certainly do it for people in St. Lucia. And then I decided to return home, although not 100% return, but I would come to St. Lucia 3-4 times in a year and do Faces of Cancer St. Lucia. And when we started off, I first met with the Cancer Society, because I figured out there's so much to be done in cancer, because when I was diagnosed, I never heard of cancer in St. Lucia. So I figured out there was so much to be done that I didn't want to duplicate what they were doing. And so we sat down, we had a conversation, and they said their mandate was to educate the general public in St. Lucia about cancer. And here I am saying, so how do you do that? Because I was in St. Lucia and I never even heard of cancer. And I was told, oh, we attend health fairs, we give talks in churches and schools, and still I didn't buy it, because to me a lot was lacking, and I had never heard of them. So I decided to first of all, help cancer patients, like the ones that were in treatment. If you needed assistance at home, if you needed us to come and sit with you for chemotherapy, we'd do that. We had prayer groups. We go to the hospital. We visit people at their homes. And most importantly, we had for survivors, we had like a little familyhood, a little sisterhood, which still exists, where we would enjoy ourselves. We would have parties, go to the beach, go for walks, go do something nature, just to make people feel like they're not dying. There's life after cancer.
Right.
And then afterwards, we decided to add a little more. We went into education because still we felt that the Cancer Society was not educated enough.
Right.
So we started going into schools, communities, churches, talking about cancer. We gave talks on surviving cancer. And then when we started in 2010, we started doing one health fair a year. And then shortly after that, we decided no, one health fair was not going to cut it. Too many people came to that one health fair. So we went with 4 health fairs a year, and still we were overwhelmed.
Wow.
So now we do like 6 in a year. We were hoping to do 1 a month, but because of COVID, we have been held back. So we have not been able to do the 1 a month for the year. We have only done 1 actually this year because of COVID, and we're hoping to start back again soon and see how much we can push before the end of the year. Because our health fair is the only health fair that we have a team of doctors, including Dr. Gabriel. We have Dr. Louise that's always there, Dr. Wilson. We have a number of doctors that partner with us and they attend our health fairs. And we offer free screening. We're the only people that do health fairs in St. Lucia. When we say free, we mean FREE. You don't pay nothing, you just be there. If you need a mammogram, you get your mammogram. If you need an ultrasound, you get your ultrasound. If you need a pap smear, you get the pap smear. If you need a PSA, you need a PSA. If you need a DRE, all of that free. It's all paid for by Faces of Cancer, not by the patient. So that is another thing we do. Apart from, we do a soup kitchen at Victoria Hospital in the cancer clinic. We had stopped, but we recommencing this coming Tuesday. They have given us the go-ahead to continue. So once a week, we provide soup for the people, soup and crackers for the cancer patients in there. Apart from that, we do our free patient navigation services, because a lot of times the patient is clueless. They come across hurdles and they do not know how to navigate the hurdles. So we're here to assist them in that regard, and it's all for free. Also, we give out a lot of supplies. We have Pampers, which we give out on a daily basis. We have ostomy bags, which we give out. We have ostomy sets, which we give out the complete sets. We have walkers, wheelchairs, walking sticks, commodes, hospital gowns, socks, you name it, we've got it, and we give it out all for free.
Wow, thank you. Wow, you guys are doing an amazing job, and thank you for that. Thank you for Faces of Cancer St. Lucia. Thank you very much. Sharon, tell us, what is something that you've discovered that you wish you knew before you started your treatment?
Wish I knew before I started my treatment. Basically, through my aunt, I knew a lot. But one thing, I was getting Neulasta, and if I knew after taking Neulasta, you would be done with bone pain, joint pain, all pains. I mean, I would prepare myself for that because I'd be flat out for a day. But practically, basically, I knew from my aunt, I knew pretty much everything because we have the same type of cancer. So basically, I knew from her. And then the fact that you lose every single hair on your body, that was me. I had hair, no part of my body, my head, my underarms, every single place. I was hairless. My nails, they were black. I mean, my toenails are still black. I mean, it never went back to form. But apart from that, I mean, I accepted everything, so it's not something. It's good. I have life, and that's the most important
Most
thing.
important
So
thing, right?
those things are just, you can just put them by the wayside because I have life. I'm still alive.
Thank God for that.
Oh yes.
Dr. Gabriel, let me ask you in terms of, I want to go into something deep here with you, doctor. In terms of your sexual life, in terms of sex, in terms of pregnancy, paternity, in terms of all of this, um, how does the treatment affect people and their sex life? And if a woman would like to get pregnant, would you suggest she have her eggs frozen before she actually take treatment? Does the treatment affect her getting pregnant and so on?
Well, absolutely. These are very, very useful questions. And our patients sometimes are very worried about those aspects of their livelihoods. In terms of, and this is why I mentioned initially that when we diagnose a patient with cancer, the histological diagnosis is not enough. We need to get that patient properly determined, properly sorted out in terms of what other factors are important to their well-being, their mental well-being, their psychological, emotional well-being. Certainly, sexual side effects are common with cancer and persons taking chemotherapy. And this is outlined in your consent form. When you give consent to chemotherapy, the risk of having sexual adverse effects would be explained to you by your doctor, and you can then make the decision. So if a woman in her fertile age, or if a woman still requires to have a family thereafter cancer, we need to have them see the relevant personnel. I mean, including geneticists, psychologists, and social workers, so that we can outline that if there is a necessity to have their eggs frozen, as you put it, that we can do so, and therefore, be able to pursue the goals of their sexual and reproductive lives, as it were. We also have situations where somebody goes in and may become menopausal after receiving chemotherapy. So we need to explain that to the patient and explain the changes in their sexual appetite as well that may occur with chemotherapy. And as I said, everybody's different. Every individual has a different experience. Some people would have had a cessation of their periods, but others may have had the continuation of that. Some women are happy that they no longer have periods after chemotherapy, but others may have other goals. And as I said, it is important to outline the possible adverse events and what can be done to mitigate into having a bad outcome during or after chemotherapy.
Thank you, Doc. Like anything else, all good things must come to an end. And I really want to continue this conversation because I think it's one that we need to have. But what I would love to do is my show is totally booked for until maybe the end of the year. But I would really love to have you guys come back on at some point. Let's have another discussion about cancer. Let's talk a little more about phases of cancer, St. Lucia. Let's talk about how we deal with life after cancer. And I also kind of like interested to know that if you've been diagnosed with stage 4 cancer, can you ever be healed, or is it just a case of the doctors doing what is necessary to keep you alive and to keep you going? Or can it be something where you go into you're cancer free? And these are some of the questions. I have a lot of burning questions, and I know my audience as well have a lot. But I really want to continue this conversation at a later date. And I'd like, I will reach out to you all individually so we can do this. But I want to thank you all so much for coming on Bouyon. Before we close, I'll give each of you all a minute to kind of share with our audience anything that you would like to. I will start with Dorothy. We'll start with you, and then we'll end with the man, with Dr. Owen, the only man in the group. Go ahead, Dorothy.
Okay, so what I would really like people to take from that is anytime you have an issue that is persistent, and when I say persistent, I mean it's there for 2, 3 weeks, no change, it's time to see a doctor. Don't give it more time and think it will get better. It's not going to get better. It's time to see a doctor. So that's one of the important things I want to let people know. It could be a fever that's 2 weeks. It could be a lot of times it's people say they have a gland and it's there for 2 weeks. No, go check it out. It might not be a gland. It might just be a cancer. So we need to look out for persistence in our life. And when something is persistent, we have to check it out. Also, as it relates to Faces of Cancer St. Lucia, we are always looking for donations because in this COVID times, St. Lucia has taken a hit economically. People are not as generous as they used to be because they can't, honestly. And we know that cancer is not waiting for the economy to turn around. People still need help. We see people needing help all the time. So we would like people to contact us and donate. You don't have to donate money. You can donate goods, like, all the things that we give out. We give to people that are in need. We don't give to people that have. We give to those that do not have or cannot get. So we would like community to come out and give. I know you guys are in New York. You want to come together and do something for Faces of Cancer. I know I might be pushing it, but
That's okay. That's one of the things we do at What Radio. We do a lot of charitable needs. We take care of a lot. Right now, we're doing a tablet drive for children in St. Lucia, and we just about a couple months ago we sent like 5 commercial bins to the elderly homes. We send like about 13 or 14 wheelchairs down and walkers and so on. So we try our best to do it, and we will keep you in mind when we start to do other ventures and so on, and we'll keep you in mind, and I will be in touch with you definitely.
Okay, thank you very much.
I before sorry Sharon, before you I wanted to ask you how does one become a member of Faces of Cancer St. Lucia?
Okay, so being a member of Faces of Cancer St. Lucia, you just have to fill out a registration form. We do not charge people for being members of Faces of Cancer because we know the need when it comes to cancer. And most of the people that come to us are people that already have cancer and we know they're struggling getting there. So we do not charge or ask for money if we know you're going through cancer now. We would like people to donate if they can. Even when we give out stuff that other people have to buy. And always say, if you can and would like to donate, we'd be happy for your donation. But we do not charge people for the stuff we give out.
Thank you. Sharon, your minute.
Okay, with me, I just want everybody to know, please, and I'm an advocate for that. Mammogram, if you have dense breast, sonogram, because mammogram will not do it for dense breast. Self-breast examination. If you feel something and do not take it on your own and say it's nothing. A second opinion, a third opinion is the key to thing. Detection for breast cancer is the key to living. And just remember, cancer is not a death sentence. My motto and my aim is, I have cancer, but cancer never had me. So just believe that you have cancer, but with all the treatments, you can survive. Whatever you do, you can survive cancer. Do not listen to people. And for me, telling your story, because telling your story, you can help somebody or somebody can help you go through your treatment. Never keep, there are people that keep the cancer to themselves, but my motto is tell your story. When you think you alone fighting a battle with this type of cancer, there are millions of people out there battling cancer. If you tell your story, someone can help you. And please do not do Google doctor.
Thank you. Thank you. Doc? It's your minute.
Well, thank you so much. I'm hoping that the message tonight, although in a short space of time, has been one of hope, that cancer is not a death sentence. Each person's cancer is different from the other. Even the same type of cancer may appear differently in a different woman. And to answer the question that I would not like us to end with an unanswered question from you, sir, that not all stage 4s are created equal. So a stage 4 cancer where the cancer has spread to the brain, or the cancer has spread to the lung, or the cancer has spread to the liver, is not the stage 4 that the cancer has spread to the bone. So we know that in the cases of the bone cancer, we may be able to do radiotherapy to that area and eliminate that spread. And therefore, that person's cancer, the profile of that cancer, the prognosis of that cancer is radically different at that point. It may not be the same if the cancer is spread to the brain or the lung or the liver, but certainly not all stage 4 cancers are created equal. And the options are so many more options for treatment. And even in stage 4, we are able to do much more for our patients. So we want to spread hope. We want to spread trust in the science. We want to spread that family support. The social network is important. Being part of groups like Faces of Cancer helps persons to go much further in their cancer outcomes than if they are facing this alone. So the experiences of other people, the teamwork among your doctor, your caregivers at home, in the community, good organizations, and yourself will contribute to the most favorable outcomes when somebody has cancer. And this is important, especially in our society where we want early diagnosis with breast cancer, with mammograms and breast self-examinations and clinical breast examinations. So we can get a healthier community. And as a nation and as the world, we will progress in a positive way to address this dreadful disease.
I know we winding down, but let me ask you, because you spoke about mammogram. Is there a particular, at what age should women start getting mammograms?
Yeah, I'm not sure I heard correctly, but I think you're asking about what age to mammograms.
Yeah, what is the age you'd recommend?
Yes, well, the overall, the American Cancer Society, other organizations have recommended to have your first screening baseline mammogram at age 40. There are a number of circumstances where you may need to have it earlier on, especially if you have a known family history of breast cancer, a first-degree relative of breast cancer. You may be able to do that mammogram as early as 35 or even 30 years old, so that you can have an earlier start of trying to identify the smallest possible lump in that breast, so as to treat it in a more effective way to have the best outcome possible.
Thank you so much. Dr. Gabriel, thank you so much. I want to thank our other guests, Sharon and Dorothy. I want to thank you guys so much. Dr. Gabriel, I have a conversation with you because I'm trying to do some men's health segment, and I probably will have a conversation about that. If you could make yourself available to us, if that's possible, that would be awesome, or maybe some of your colleagues as well. So, but I want to thank you guys so much.
Absolutely.
I want to thank everyone who has joined us tonight on Bouyon. Remember, you tune into Bouyon on Watch Radio, and tonight we're discussing breast cancer, and we're trying to help you understand that breast cancer is not, as Sharon keeps saying, it's not a death sentence. It's a hurdle, yes it is. It's something that we have to deal with if you're diagnosed with it, but don't look at life as all grim. We can survive it. So I just want to encourage you guys, if something is not feeling right, to go and have yourself checked. And we did not talk about men tonight, and I'm leaving that for when when I'm doing men's health. But men are also men can also have breast cancer. In the US, 2,600 men are diagnosed every year with breast cancer. And out of the 2,600 men that are diagnosed, about 560 of them potentially die from breast cancer. And the majority of the individuals who are diagnosed with breast cancer, men, that is, are Black men. So, guys, if something is not feeling right, let us go and get it checked. Let us get it checked. I'm a culprit because my wife always have to, be kicking me out the door. Go see the doctor. Go see the doctor. Go to the doctor. You need your annual checkup and so on. But I want to encourage men to do that. So that's why I want to do Dr. Gabriel. That's why I want to have a men's health segment so we can talk about men's health and all of those stuff, prostate cancer, lung cancer, all of these, ED and all of these kind of conversations that we need to have. Once again, I want to thank you guys so much. Like anything else, all good things must come to an end. Tune in to Bouyon next Sunday. We'll be dealing with mental health. And I think that's a really important topic because so long we kind of forget or we stereotype people who are suffering from mental health. And I think it's a good conversation to have. And we'll have with us Anthony Husbands. He's a Barbadian, I think by birth. Yes, he'll be joining us to talk about mental health. I think it's a very important topic to have. Once again, guys, I want to thank you so much for joining us in Bouyon. Look forward to talking to you guys again. Thanks so much. And thank you guys. Good night and so long.
Good night.
Good night.
Good night, everyone.